Body feminization for gender-affirming surgery. It includes full body lipo, narrowing of the waist with both lipo ribs, expansion of the hips and buttock. This patient had a previous breast augmentation with me, and she's now coming in for the second part of her body contouring. All right, body feminization, bringing in the waist with both lipo and rib remodeling, and then expansion of the thigh to create more of an hourglass effect. Gender-affirming surgery, we're going to be doing liposuction of the upper back, mid-back, waist. Something, when patients are online looking at videos, a lot of times they want to see other patients that look like them, and I think that's a really it's a good strategy, so you have realistic expectations. This particular patient has a little bit more fullness and around the hip roll and waist area, as you can see on the preoperative photo. So really the trick here is going to be to really contour this down and create a smooth, gentle curve. We're going to rib remodel the 9th, 10th, and 11th rib. Her 12th rib is a little bit hypoplastic or short, so there's some technicalities. If the rib is too short, sometimes we can't treat it, because if it's like this short, then it won't make a difference, plus it's too deep to access. So the point is, rib remodeling, depending on the CAT scan, we determine which ribs we treat. Lipoing this area to really create that dramatic contour hourglass effect, and then expansion of the buttock and hips. So after we do that, what you can see here is this. So I'm going to push down. It's really, really nice. You could see with the marking how that, you see where the marking is? It's like it really shows you how much of a difference that makes with the angulation of the ribs. Alright, so we showed you, took you through the steps of rib remodeling. You can see really nice improvement in the hourglass, waistline, expansion of the hips. So the combination of a waist to hip ratio, that really determines the degree, or it's an objective standard for femininity. Smaller the waist, wider the hips, smaller the fraction, the more hourglass the effect. So you can see nice improvement in the hourglass effect. We brought in the ribs. She was very, very tight here, so we did not get a lot of expansion, but I did get as much as I could, and most of the magic is in the waistline.